This is a case of a 14-year-old boy who underwent GRT surgery in a center but could achieve the desired result. The patient was referred to me for a re-intervention. We can see here that multiple bubbles of PFCL which are scattered all around on the posterior pool. They were removed by using passive suction. The retina had developed permanent folds and it had folded upon itself as well. There was a fold which was underneath, so it was a double fold, inverted fold sort of thing. We use the diamond dusted scraper here to unroll it. In my hands, the diamond dusted scraper works the best. Unlike the other forceps, which when I use to untie or unroll the edges, it causes inadvertent retinal tears or bleed. We use the diamond dusted scraper in a sweeping manner. Here we use the light pipe also to relieve some adhesions which were more firmer and were not amenable for diamond dusted scrapers to be relieved. We use the diamond duster scraper in a manner in which we avoid the supraparietal areas like the macula. We can see that there are still a lot of PFCL bubbles which are still present. We are alternately using the diamond duster scraper. What we can notice here that the surgeon had attempted to make a posterior retinotomy and laser around it, and this had aggravated the subretinal fibrotic process. You use the ILM forceps to remove the chorioretinal fibrosis which is bridging the retina, and once we have removed it and we are up to the satisfaction, we use the vitrectomy cutter to further remove these debris. We see that there are multiple PFCL bubbles which are still present underneath the retina, and we use the passive suction of the fluid cannula to remove it as much as possible. Once we have satisfactorily unrolled the retina, we use the PFCL to further unroll it and use it for our satisfaction. We use the brilliant blue dye from Orolab to stain underneath the PFCL to do a arcade to arcade ILM peeling. What we can notice that is there is a tuft of PFCL bubble which is still present. We continue with doing the ILM peeling underneath the PFCL, which is a preferred technique in my hand. And once we have done a satisfactory ILM peeling, we can still notice that there is a fold of retina which is still present at the macula. So once you can see, and what we do is we again use the diamond duster scraper to further unroll and iron out the retina underneath the macula so that this fold can be relieved as much as possible, and this is transmitted to the periphery. Once we have done it, we proceed to remove the subretinal PFCL, the large bubble underneath it. Initially, we tried to do it by using a passive suction, but thanks to our effort that it came out into the vitreous cavity. The next step is to just complete the 360-degree retinectomy, and once we have done it, we proceed with trimming of the remnant retina. And the rest of the steps are usual in a case of a 360 retinectomy with a 3 to 5 rows of laser and using the posterior retinotomy along with the encasing in the retina. We do a direct PFCL exchange under the Sandlin illumination, and these are 1 month post-op results.